I went to the kitchen, fired something up on the stove, and when I went to go stir it, all of a sudden a huge flame kind of erupted out of the pot. Literally, I just remember hearing the sound, whoosh, and it just literally lit my entire body on fire.
So the day was an average day. We got in, we did our checks, we did our chores, we did our exercises, and then the call came in for a structure fire in the early afternoon.
Local station alert. Local station alert. Local station alert.
When we got en route, we heard more information from dispatch, and they told us that there was actually a patient involved that had been burned. And so when we got on scene, our chief brought the patient out to us, and that's when we started assessing the patient.
The EMS and everything jump on me right away, and the next thing I know, I'm on my back. You know, they're saying first degree, second degree, third degree. I didn't know any of this stuff meant. And then all of a sudden they said, we're going to go to the Medical Center of Plano Burn Trauma Unit.
We realized this was really severe, and we knew that we had to act fast. We had just been educated on the fact that the Medical Center of Plano was now a burn center and could treat burns such as this.
One of the many nice things about the relationship that the Medical Center of Plano has with many of the local fire departments is that early contact, so that we can prepare and triage for what's coming in.
While en route to the hospital, I radioed in to the ER to let them know that we were on our way and the status of the patient and the patient's condition, so they could get everything ready in order to treat the patient properly.
So we have a multidisciplinary team that arrives and is actually standing there ready to go when EMS personnel bring the burn patient in. And it's that immediate and quick care that's very important.
Chris came to the hospital after suffering grease burns. Grease can be heated hotter than water, so you have a higher temperature to burn the skin. In addition, grease is a chemical, so you have a chemical burn on top of the thermal burn. And you get total burn care here. Surgery, treatment, rehab, excellent nursing care, ICU care. Everything is done here at one institution. I think we were able to tackle this very difficult burn, and I think gave him a fantastic functional, aesthetic, reconstructive result. And I would say that I don't think it would have been better anywhere else.
We're just looking back, my family and I are so grateful, one, that Prosper was there as fast as they were on it the way that they were, they called, checked back up on us. Just can't underestimate the influence and the power that those people have over people's lives in those moments. I mean, I'll always remember their faces. I hope to never have to ever go back to the burn unit at ICU. On the flip side of that, every time I go, I pop upstairs and check in and say hi to some of the folks that cared for us while we were there, just because the relationships and the connection and the quality of our experience was such that we just want to come back and say thank you every time we can. I'm just grateful. I'm very grateful for what they did. I'm very grateful for how they cared for us and just the confidence that they gave to us in the midst of a situation that didn't breed a lot of confidence by itself.